Hello, I'm presenting my patient today. My patient is AR, a 7-year-old male. Chief complaint. Mother states that child has a pink eye. History of present illness. A 7-year-old Hispanic male was brought to the clinic by his mother and states that child woke up with a pink eye yesterday. The patient states that his eyes were very itchy in the morning, appeared pink, and reported discharge. According to the patient, no foreign object or trauma was causing his symptoms. Patient denies chest pain, wheezing, sore throat, shortness of breath, and fever. Patient does not use contact lenses. Past medical history. No known allergies. Patient is not currently on any medications. No hospitalizations, no surgeries, and immunizations are up to date. Family history. Patient lives with both his parents and 2 younger siblings. Both parents work full-time. They live in a 1-story house and report no one in household smokes. Mother reports a safe home environment, no significant family history or disease or illnesses reported. Review of symptoms. Review of systems. General. Well nourished, no recent illness. Eyes, redness, and bilateral itchiness. No trauma to eye. No headache, denies any vision changes. ENT. No nasal discharge or congestion reported. Cardiovascular. Mother denies any changes to his physical appearance. Respiratory. Mother denies history of respiratory infection, shortness of breath, wheezing. GI. Negative for abdominal pain, nausea, vomiting. Denies any constipation or diarrhea. Gentle urinary. No history of infections. Patient is able to void. Musculoskeletal. Mother states patient has full range of motion. Neurological. Appropriate interactions. Endocrine. Weight is appropriate. No concerns reported. And hematologic. Mother denies any bruising or bleeding. Objective data. At time a patient was at clinic, all vital signs were stable. General, patient was well nourished, well developed for age. Negative for decreased activity, fever, and fatigue. HEENT, conjunctiva red in both eyes. Mild light water discharge. Pupils are round and sensitive to light. No eyelid edema. Red reflex present in both eyes. 20/20 vision in distant and near bilaterally. No nystagmus. No crusting noted in both eyes. Tympanic membrane was normal in bilateral ears. No exudation noted. No nasal discharge. Mouth was pink and moist. No lesions or masses present. Tonsils were normal size. Cardiovascular. Regular rate and rhythm. No murmurs heard. No chest pain was present at time of examination. Respiratory. Breath sounds were clear and bilateral. No retractions, wheezing, or shortness of breath. GI. Bowel sounds were heard in all 4 quadrants. Abdomen was soft and non-tender to palpitation and non-distended. Gentle urinary. No bladder distension noted. Musculoskeletal. Patient demonstrates full range of motion with no signs of pain. Integument. No scaling or breaks on skin, face, neck, or arms noted to upper and lower extremities. For assessment, based on our assessment, our diagnosis was viral conjunctivitis. Other differential diagnoses include bacterial and allergic conjunctivitis. And based on the symptoms, we felt that this was an appropriate diagnosis for my patient. What was discussed during the visit was the use of lubricant drops and applying cold compresses to both eyes. Proper hand hygiene, avoiding public swimming pools, and sharing of towels were also discussed with both patient and mom. And mother was instructed to return to clinic if no improvement or worsening of symptoms were noted. I agree with the plan of care that my preceptor chose based on the diagnosis and the patient's symptoms. I felt that discussing supportive care was the best option for improvement and treatment, and no medications were needed because it was a viral infection. We discussed how, just like a viral respiratory infection, the disease has to run its course. Thank you.